Hi, Dr. Lazemnik. So for my final project, I chose Parkinson's disease. I chose this genetic disorder because my uncle was diagnosed at the age of 25 with early onset Parkinson's disease, and he died about 2 years ago because of it. And so I wanted to learn more about kind of the effects within his genotype that might have caused it, as well as some other environmental factors for the disease. So getting into what is Parkinson's, it's a progressive disorder of the nervous system and affects several regions of the brain, particularly the substantia nigra, which is in the middle of the brain, and that controls balance and movement as well as the reward system. So the development of Parkinson's is caused by the breakdown of dopamine pathways within the brain. So people with this disorder usually have lost about 50 to 60% of dopamine by the time that they're diagnosed, and that's all within the area of the brain that I mentioned before. And as I mentioned at the really beginning, the disease is influenced by both genetic and environmental factors, where only about 15 to 20% of cases are linked directly to genetics. So getting into the symptoms of the disorder, it usually begins with a trembling or shaking of a limb, especially when the body is at rest, that's when you notice it. It starts off on one side of the body, so for example, maybe your left hand will start shaking, but eventually it could cause trembling in the arms, legs, feet, and the face of a person with Parkinson's. There are some other symptoms of Parkinson's, which include stiffness of limbs, slow movement or the inability to move at all, and also impaired balance or coordination. And then this disorder also affects the cognition of an individual. So some affected people have developed depression and hallucinations, as well as other cognitive-related disorders such as dementia. So not all of these symptoms occur at once. There are different stages of Parkinson's. So within the first stage, this is where you'll start to notice a trembling of maybe one limb or one hand, and so there's very minimal symptoms. In the second stage, the disease becomes more noticeable and affects the entire body, so this is where you might see, more than one limb shaking or the entire body just shaking or trembling. The stage number 3 is where you find the loss of balance and coordination, and routine activities become really hard for an individual to accomplish. Stage 4, it's nearly impossible to live by yourself, and basic or routine activities are really difficult to complete. And by stage 5, this is where you see the severeness of the disease, so the development of dementia or depression or hallucinations, and it usually causes patients to be confined by their beds, and this is where a lot of deaths occur within the disease. So for the risk factors of Parkinson's, the first one and the most popular is age. So most cases of Parkinson's occur over the age of 50. The average age for the onset of the disease is 60, although early onset can occur just as it did in my uncle, where people even under the age of 20 can get the disease, and that's known as juvenile onset Parkinson's disease. In addition, the sex of an individual is really important when developing Parkinson's. So males are 50% more likely to develop Parkinson's. Researchers have said that this is because the disease might be genetically inherited via the X chromosome, and so females have 2 of them, so they're least likely to get it, whereas males only have 1 X chromosome, so they might be more likely to get it. And also the role of estrogen within the body, and especially the development of the brain, might also affect who gets Parkinson's versus who doesn't. There are also several and so there are also a lot of genetic causes. So there's mutations in inherited genes as well as spontaneous mutations, and family history kind of plays a role, which I'll get into more in a second. So continuing on with different risk factors, there's also an interesting study talking about those who work in the agricultural sector. So the exposure to pesticides and other environmental toxins create a greater risk of developing the disease, as they might inhibit dopamine production and promote free radical damage, which and Parkinson's also causes the inhibition of dopamine production, and also head trauma. So again, a lot of brain trauma or brain injury might cause Parkinson's. So getting more into genetic mutations, as I just said, so there are a couple that cause Parkinson's, including mutations in the LRRK2 gene, PARK7 gene, PINK1 gene, PRKN gene, and the SNCA gene. There are also additional ones that could cause Parkinson's via spontaneous mutations for the disorder. And then there's also alterations in the genes GBA, and UCHL1 that may not cause Parkinson's directly, but increases the risk of developing the condition in an individual. In addition to that, other genetic mutations that relate to the breakdown of dopamine-producing neurons or an impairment of functioning cells can also lead to the development of Parkinson's. So just some examples of how gene mutations affect a patient with Parkinson's. So the SNCA gene that encodes the protein alpha-synuclein is linked to dementia in Parkinson's disease, and it's associated with the early onset form of sporadic Parkinson's disease. The UCHL5 gene produces, I'm going to butcher this, but bear with me, the ubiquitin carboxyl terminal hydrolase. So in this mutation, it creates an abnormal protein processing where proteins are not discarded when they should be. So abnormal cell death occurs where it's adverse cell reactions, and so some cells might die when they shouldn't, and other cells that should be discarded may not, which causes a lot of problems in the body. And then lastly, the PARK7 gene encodes a protein called cyclin A. Researchers found that people with sporadic Parkinson's disease seem to have an excess of cyclin A in the dopamine-releasing neurons of patients, and it also causes neurons to die, which, as we learned earlier, can cause Parkinson's disease. In terms of how the gene or the genetic disorder is inherited, so it's really dependent on how the gene is affected and which gene is affected. So when the LRRK2 or the SNCA gene is mutated, the disorder is inherited in an autosomal dominant pattern, so you only need one parent to have it, whereas in the PARK7, the PINK1 or the PRKN gene, it's inherited as an autosomal recessive disorder, where there must be two mutated parents that can pass it on to their offspring. And it's also unsure how and if the disorder is inherited if it's caused by sporadic mutation. So for the treatment of Parkinson's, there are a couple of forms, including medication and surgery. The most popular form for medication is a prescribed drug called levodopa, and it works by converting dopamine in the brain. So the chemical will become dopamine and it'll go through the blood barriers within the brain. So then that solves the problem of patients with dopamine losing a lot of their dopamine. And it's also known as a precursor to dopamine as it prevents the depletion, as I just mentioned. So the second form of treatment and the more serious one is surgery. So it's something called deep brain stimulation, and it's used for patients with severe Parkinson's. So in this case, an electrode is implanted into the brain, and then it's attached to a pulse generator that's placed right in the chest, right underneath the skin above the heart. So this stimulates the body and it minimizes effects like the inability to walk, the severity of tremors, and other physical symptoms, but it also minimizes and eliminates any side effects that might be experienced from medication. So there's typical side effects such as like the inability to sleep, problems walking, and other health-related concerns, and this surgery minimizes that. But this surgery also causes more risk because the chance of having a stroke is higher during recovery as it is a brain surgery, and strokes can then cause permanent brain damage and even death in some patients. So getting into the significance in Parkinson's disease, over 4 million people are affected worldwide, and there's also 60,000 new cases identified each year for Parkinson's, so around 13 per 100,000 people have the disease. So in the United States alone, over 1 million people are affected, and late onset Parkinson's is the most popular form of the disease. The risk of developing Parkinson's increases with age. It's the #1 risk factor, and it's because people continue to live longer, the threat of people developing the disorder increases in the future, which is why it's imperative to educate people about the condition and develop proper treatments to slow the progression of the disorder. And also moving forward with treatment, Parkinson's disorder has evolved in numerous ways in forms of treatment. It went from medication to surgery, and they're currently at the forefront in using cannabis to treat symptoms and the progression of the disease. So I'm going to play a short clip. It shows a man with severe Parkinson's, and he tries cannabis oil for the first time, and you could see the way that it really helps him. So I'll try and skip forward. Alright, so as you can see from the video, there are a lot of benefits to using cannabis treatment or cannabis oil. Um, all of his tremors were completely disappeared, and also his hand movement was better. And as the video progresses, you could tell that his voice has returned to him back normally. So it shows that it could be really important to use cannabis oil in the future, and it also just shows the future of medicine for similar genetic disorders such as this one. And then lastly, just from a cultural and personal perspective, I find it really interesting to learn more about this disease because my family was directly affected by it. So I find it really important, and not everyone knows or even understands the effects of this disease. So I find it really important to create this presentation as a way to educate other people and just to educate people about the disease. And moving forward, I hope that more people understand the cultural significance because it really just destroys someone personally. And so it's really hard on families and individuals that have it. It's almost like they just lose someone before they eventually, they might die because of the symptoms. So I found it really important to focus on this for my final project. And then here are all my works cited. So this includes all the pictures, the videos, as well as where I got all my information. So thank you very much for listening. Hope you learned something about